Are you getting the most out of your doctor visits, or are there communication barriers you don't even realize exist? The relationship between seniors and their healthcare providers often suffers from misunderstandings that could be easily resolved with better communication strategies. Today, I'll share 5 insights that will transform how you interact with your healthcare team and help you become a more empowered patient who receives better, more personalized care. These aren't just theoretical concepts, but practical strategies that thousands of seniors have used to dramatically improve their healthcare experiences. The 5th truth might completely change how you prepare for your next appointment and could be the key to receiving the personalized, attentive care you deserve and have every right to expect. Beverly from Tampa thought her doctor was dismissing her concerns about persistent fatigue as just normal aging. She felt frustrated and unheard during appointments, assuming her physician simply didn't take her seriously because of her age. After learning these communication strategies, she discovered she had a treatable vitamin deficiency that her doctor had been trying to investigate all along, but her incomplete symptom descriptions had made diagnosis difficult. Sometimes the problem isn't what doctors think about us, but how effectively we communicate our needs and concerns to them. Truth 1. Doctors worry you're not speaking up enough. Your doctor wants to hear about all your symptoms, not just the ones you think are serious enough to warrant medical attention. This might surprise you, but healthcare professionals often express significant frustration when patients hold back information about their daily discomforts, minor aches, or subtle changes they've noticed, assuming these details aren't important enough to mention during appointments. What you might consider minor complaints or normal inconveniences could actually provide crucial diagnostic clues that help your doctor understand the complete picture of your health status. The reality is that doctors are specifically trained to piece together seemingly unrelated symptoms to identify underlying conditions that might otherwise go unnoticed for months or even years. Many diagnostic breakthroughs happen when patients finally mention that little thing they thought wasn't worth discussing, which turns out to be the missing piece of a complex medical puzzle. Research from Harvard Medical School shows that patients who provide comprehensive symptom information, including what they consider minor details, receive more accurate diagnoses and significantly better treatment outcomes than those who only report major concerns. Their extensive studies reveal that incomplete symptom reporting is one of the leading causes of delayed or missed diagnoses in older adults, where multiple systems may be affected simultaneously. When you withhold information about subtle changes in sleep patterns, minor shifts in energy levels, occasional dizziness, or new aches and pains, you're potentially depriving your doctor of essential diagnostic information. Harvard researchers consistently emphasize that no symptom is too small to mention, especially for patients over 60, where seemingly unrelated symptoms may actually be interconnected in ways that aren't immediately obvious to either patient or doctor. Their geriatric specialists report that some of their most important diagnostic discoveries came from patients who almost forgot to mention what seemed like trivial details. Consider the enlightening case of Eugene from Detroit, who casually mentioned his minor morning stiffness almost as an afterthought during what was supposed to be a routine blood pressure check. That seemingly insignificant comment led his experienced doctor to order specific tests that revealed early-stage rheumatoid arthritis, allowing for immediate intervention that preserved his mobility and prevented joint damage. Eugene later realized that what he had dismissed as just getting old was actually a serious autoimmune condition that responded extremely well to early treatment, and his quality of life improved dramatically once proper therapy began. His doctor explained that catching the condition early made all the difference in long-term prognosis, something that wouldn't have happened if Eugene hadn't mentioned his morning stiffness. Write down every physical change you notice over the next week, no matter how trivial it seems to you, and bring this comprehensive list to your next appointment without editing anything out. Include changes in appetite, sleep quality, energy levels throughout the day, mood fluctuations, or any new aches and pains you've been experiencing, even if they seem completely normal for someone your age. Ask your doctor directly if they want to know about these symptoms, and you'll likely be surprised by how genuinely interested and grateful they are for these detailed observations. Don't wait until your next scheduled visit to start documenting these changes. Begin your symptom journal today. Truth 2. Time constraints make prepared patients stand out. Did you know the average doctor visit lasts only 18 minutes according to recent comprehensive studies by major medical institutions? This significant time limitation isn't because your doctor doesn't care about you or considers you unimportant, but rather reflects the challenging reality of modern healthcare systems, where physicians often see 30 or more patients per day, while also managing administrative tasks, reviewing test results, and consulting with specialists. Within these precious 18 minutes, your doctor needs to review your medical history, conduct a physical examination, discuss your current concerns, answer your questions, and develop a comprehensive treatment plan. When patients come unprepared or disorganized, much of this valuable time gets wasted on gathering basic information that could have been organized and presented efficiently beforehand. Prepared patients allow doctors to focus their expertise on diagnosis, treatment planning, and education, rather than scrambling to collect scattered information. The American Medical Association conducted comprehensive time studies involving thousands of patient visits, showing that well-prepared patients receive significantly more focused attention on their actual health concerns and treatment options. Their detailed research demonstrates that patients who bring organized lists of questions, current medications with dosages, and clear symptom timelines allow doctors to spend substantially more time on diagnosis, treatment discussion, and patient education rather than basic information gathering. These prepared patients consistently report higher satisfaction with their care, better understanding of their conditions, and improved health outcomes over extended periods. The AMA research emphasizes that patient preparation is one of the most effective ways to maximize the value and effectiveness of medical appointments, regardless of the time constraints imposed by healthcare. Their studies show that prepared patients receive more thorough examinations, more detailed explanations of their conditions, and more personalized treatment recommendations. Clarence from Phoenix completely transformed his healthcare experience by developing a simple but effective preparation system before each medical visit. He would carefully write down his 3 most important questions in order of priority, create an updated list of all medications and supplements with exact dosages, and prepare a chronological timeline of any new symptoms or changes since his last appointment. His longtime doctor immediately noticed the dramatic difference and was able to address complex cardiovascular issues that had been overlooked in previous rushed appointments, where time was wasted gathering basic information. Clarence's organized approach allowed his doctor to spend quality time discussing treatment options and lifestyle modifications that significantly improved his heart health. Their appointments became much more productive and satisfying for both patient and physician. Create a simple but comprehensive appointment preparation routine that includes writing down your top 3 health concerns in order of importance, creating an accurate list of all medications and supplements you're taking with exact dosages and timing, and noting any symptom changes or new concerns since your last visit. Organize this information clearly in order of priority so you can address the most important and urgent issues first during your limited appointment time. Print out or clearly handwrite this information so you can easily reference it during your visit without fumbling through notes or trying to remember important details. Start implementing this preparation system before your very next medical appointment, regardless of whether it's routine or urgent. Truth 3. Many aging symptoms are actually treatable conditions. Doctors often encounter treatable conditions being unnecessarily dismissed by patients as simply getting older or inevitable consequences of aging. This represents one of the most frustrating and heartbreaking aspects of geriatric medicine, where patients accept declining health, increasing pain, or reduced mobility as completely inevitable when many of these symptoms actually indicate highly manageable medical conditions. Healthcare providers frequently encounter patients who have been suffering needlessly for months or years because they assumed their discomfort, fatigue, or physical limitations were just normal parts of the process. The concerning truth is that while aging does bring certain expected changes to the body, many symptoms commonly attributed to age are actually clear signs of specific conditions that respond exceptionally well to proper treatment, lifestyle modifications, or therapeutic interventions. This misconception prevents countless seniors from seeking help for problems that could dramatically improve their quality of life. Mayo Clinic geriatric medicine specialists have systematically identified dozens of conditions that are routinely misattributed to normal aging by patients themselves, often for extended periods before proper diagnosis. Their extensive research shows that symptoms like persistent fatigue, balance problems, memory difficulties, joint pain, sleep disturbances, digestive issues, and mood changes frequently have underlying medical causes that are completely treatable with appropriate interventions. Mayo Clinic doctors consistently emphasize that the phrase, "That's just what happens when you get older," should be an immediate red flag for both patients and healthcare providers, signaling the need for thorough evaluation rather than passive acceptance. Their experienced geriatric specialists report that patients who actively question whether symptoms are truly age-related often discover treatable conditions like thyroid disorders, vitamin deficiencies, medication interactions, or inflammatory conditions that can significantly improve with proper management. The Mayo Clinic research demonstrates that assuming symptoms are age-related without proper evaluation often delays important treatment that could prevent further decline. Maxine from Seattle spent nearly 2 frustrating years accepting her progressively worsening balance issues as an inevitable part of getting older, gradually limiting her activities and avoiding stairs or uneven surfaces. She finally decided to ask her doctor directly if anything could be done to help her stability problems, rather than just accepting them as unchangeable. Simple diagnostic tests revealed that her balance problems were caused by a treatable inner ear condition that responded beautifully to specific balance exercises and minor dietary changes recommended by a physical therapist. Within 3 months of starting treatment, her stability improved so dramatically that she returned to hiking and dancing, activities she thought she had lost forever. Maxine frequently expresses regret that she waited so long to speak up, realizing she could have avoided 2 years of unnecessary limitation and worry. Always ask your doctor directly and specifically whether any new symptom you're experiencing is truly just normal aging, or if there might be an underlying treatable cause that deserves investigation. Use the specific phrase, "Is this something we can treat or improve, or is this just normal aging?" to get a clear, honest answer about your options and potential interventions. Don't accept vague or dismissive responses without asking for specific explanations about why certain symptoms might be considered normal for your age group, and request referrals to specialists if your concerns aren't adequately addressed. Make this direct questioning approach a standard part of every medical appointment going forward, ensuring that no treatable condition gets overlooked. Truth 4. Your doctor wants you to be an active healthcare partner. Are you currently a passive patient who simply nods along with recommendations, or do you actively engage as an informed healthcare partner in your own care? Most doctors strongly prefer working with patients who ask thoughtful questions, take careful notes, and actively participate in healthcare decisions rather than simply accepting recommendations without engagement or understanding. Healthcare providers consistently report that active, engaged patients tend to have significantly better health outcomes because they're more likely to follow treatment recommendations they truly understand and believe in. When you engage actively and thoughtfully with your healthcare team, asking questions and seeking clarification, you're not being difficult, demanding, or disrespectful. You're actually making your doctor's job easier and much more effective. Active participation helps ensure that treatment plans are realistic, appropriate, and tailored to your specific needs and lifestyle, rather than generic recommendations that may not work for your situation. Johns Hopkins patient engagement studies have consistently demonstrated over many years that patients who ask questions, request detailed explanations, and actively participate in treatment planning receive more personalized, effective, and comprehensive care from their healthcare providers. Their groundbreaking research shows that doctors spend significantly more time explaining treatment options, discussing potential side effects, and customizing approaches when working with engaged patients who demonstrate genuine interest in understanding their conditions. Johns Hopkins researchers have found that active patient participation dramatically reduces medical errors, improves treatment compliance rates, and leads to measurably better long-term health outcomes across all age groups. Their studies reveal that doctors actually appreciate and respect patients who come prepared with thoughtful questions, who take notes during appointments, and who take an active interest in understanding their health conditions rather than passively accepting whatever is recommended. This engagement creates a collaborative relationship that benefits both patient and physician. Consider the transformative experience of Vernon from Nashville, who decided to start bringing a notebook to all medical appointments and began asking his doctor to explain medical terms and recommendations in plain, understandable English. This simple change in his approach to healthcare visits led to a crucial discovery that his prescribed physical therapy regimen wasn't providing expected results because he had been performing the exercises incorrectly for several months due to misunderstanding the instructions. His active questioning and note-taking revealed this important miscommunication and allowed his treatment team to provide proper demonstration and written instructions that got his rehabilitation back on track. Vernon's newfound engagement with his healthcare team resulted in faster recovery, better outcomes, and a much more satisfying relationship with all his healthcare providers. Bring a dedicated notebook or use your smartphone to take detailed notes during all medical appointments, and don't hesitate to ask your doctor to repeat, clarify, or explain in simpler terms anything you don't fully understand the first time. Ask specific, direct questions like, what exactly does this test result mean for my health? And what should I realistically expect from this treatment in terms of timeline and results? Always request that complex medical terms be explained in everyday language you can easily understand and remember. Transform your next appointment by preparing at least 3 specific questions about your health, treatment options, or concerns, and don't leave until you're satisfied with the answers you receive. Truth 5. Communication barriers often prevent optimal care. Doctors consistently express that they wish they knew much more about your daily struggles, limitations, and challenges at home, because this practical information is absolutely crucial for developing truly effective, realistic treatment plans. Many healthcare providers report significant frustration that they only see patients in sterile clinical settings for brief appointments and have very limited understanding of how medical conditions actually impact daily life, independence, and quality of life at home. Your doctor needs to understand specific details about your daily routine, such as whether you're having trouble opening jars, safely climbing stairs, getting dressed independently, or maintaining your usual social activities, because these functional details directly influence treatment decisions, referral recommendations, and realistic goal setting. When you describe only clinical symptoms without explaining how they affect your actual daily activities and independence, your doctor may not fully grasp the true scope of your challenges or the real impact of your condition on your life satisfaction and functioning. The CDC's extensive health communication research consistently emphasizes that patients who provide detailed descriptions of their functional limitations daily challenges, and real-world struggles receive more comprehensive, practical, and effective treatment recommendations from their healthcare provider. Their studies demonstrate that doctors who gain a clear understanding of how medical conditions impact patients' daily lives are significantly more likely to make appropriate referrals to helpful specialists, recommend useful adaptive equipment or home modifications, or suggest realistic lifestyle modifications that actually work within the patient's living situation. CDC researchers have found that communication about daily functioning and practical limitations is especially crucial for older adults, where the primary goal of treatment often focuses on maintaining independence, safety, and quality of life, rather than simply treating isolated diseases or abnormal laboratory values. Their research shows that patients who effectively communicate their real-world challenges receive more holistic, patient-centered care that addresses their actual needs and priorities. Joyce from Portland discovered the tremendous value of this approach when she began describing her complete typical day to her doctor instead of simply listing isolated symptoms or test results. She took time to explain in detail how her joint stiffness made morning routines challenging and time-consuming, how afternoon fatigue affected her ability to prepare meals or maintain her home, and how evening pain interfered with sleep quality and social activities. This comprehensive, realistic picture of her daily experience led her doctor to recommend occupational therapy evaluation, suggest practical home modifications like grab bars and jar openers, and refer her to a sleep specialist who addressed her pain-related insomnia. These targeted interventions, based on her detailed functional description, dramatically improved her daily comfort, independence, and overall life satisfaction in ways that treating only her clinical symptoms never could have achieved. During your next medical appointment, take time to walk your doctor through a complete typical day in your life, describing in specific detail which activities have become more challenging, painful, or impossible since your last visit. Be thorough and honest about practical tasks like cooking, cleaning, driving, shopping, or participating in social activities that may be affected by your current health conditions or limitations. Ask your doctor directly how your treatment plan can be modified or expanded to address these specific daily challenges, rather than focusing only on treating clinical symptoms or laboratory value. Make sharing this real-world perspective a standard part of every medical visit to ensure your care plan actually matches your daily needs and life goals. These 5 crucial insights reveal that most communication problems between doctors and senior patients stem from preventable misunderstandings and communication gaps, rather than lack of caring or competence on either side. Your healthcare providers genuinely want to give you the best possible care and achieve optimal outcomes, but they need your active participation, honest communication, and detailed information to make that happen effectively. By implementing these practical strategies consistently, you'll build stronger, more productive relationships with your entire healthcare team and receive more personalized, effective care that addresses your real needs, concerns, and life goals, rather than just treating symptoms or numbers on laboratory reports. If these insights will change how you approach your next doctor visit, hit that like button to help other seniors discover this important information that could transform their healthcare experience. Share this video with friends and family members who could benefit from better healthcare communication and more effective medical appointments. Comment below and tell me which truth surprised you most, and let me know how these strategies work when you try them at your next appointment.